story that everyone has its eye out on. What does it mean when Bharat Biotech says that its interim analysis of phase 3 clinical trials shows an 81% efficacy? It's an important announcement because it's one that everyone has been waiting for. Remember, Bharat Biotech and Covaxin came under a cloud because people, including medical experts, were questioning why it had got the authorization to be administered when phase 3 trial results were not out yet, unlike other vaccine candidates. All through, Bharat Biotech and the government has been saying that it is a safe vaccine, and the permissions have been given on the basis of very strong phase 1 and phase 2 trials. Now, phase 3 trials seem to have been completed, seem to be out. The interim analysis shows an efficacy of 81%. So just for perspective, Covishield, which is the other candidate, after 2 doses has an efficacy of 62% right now. Bharat Biotech has an efficacy of 81% in those who have not been infected by COVID-19 so far after 2 doses. This, of course, so far is an announcement from the company. We have to still wait for peer-reviewed journals to publish this information. We also have to wait for the final analysis, but there's no doubt that it's a vindication, it's a shot in the arm for them, at least as of today. What does it really mean? I'm speaking today to Dr. Ashutosh Raghuvanshi, CEO and MD Fortis Healthcare, who joins us on the show. Dr. Raghuvanshi, great to have you on the show as always. Let me begin by asking you about this 81% versus 62% versus 90-odd% in different vaccine candidates, vaccines all over the world. Why does this efficacy number matter? What does it mean?
Yeah, Tamanna, I am not an expert on vaccines. However, it is very clear that more the efficiency, the better a vaccine is. And 81%, as you said already, is comparable to the other approved vaccines in other geographies. And I think that should remove the hesitancy which a lot of people had about taking Covaxin. And I think that's a great news for the country. And I think Honorable Prime Minister, by taking a Covaxin, has already demonstrated his faith into the vaccine. And now the scientific numbers, as they get published, I think that will get further reinforced. And that would help in a big way to cover large populations and achieve the herd immunity which we desire.
You know, let me move to the other big question really of private sector being able to finally give these vaccines, administer these vaccines. There has been a very tight control on the dissemination of vaccines so far in India, and to be fair, that's the case all across the world where central governments are really controlling the way vaccines are given out. Do you think it's time now to open up, considering the rush we have seen over the first couple of days in the whole vaccine rollout? Do you think private hospitals are prepared to take on that load?
Yeah, so I think it is very important that in a calibrated manner, the vaccination drive is taken to the next level. And I think what has happened in the last few days has demonstrated that there are certain glitches in the, say, the app, etc., which need to be smoothened and ironed out before we can go to the next level. So the private hospitals, as you mentioned earlier, can now give the vaccine 24/7, which is a good thing. However, in order to give vaccine 24/7, infrastructure will have to be created. People will have to be deputed to do so, etc. So the private hospitals, I can assure you, are totally geared up, especially our system and many other systems I have spoken to. All the networks are very much ready to participate in this exercise and step it up to the, say, 10 times the number of what we are currently doing. As a kind of benchmark, if I have to tell you that today we did about 1,400 vaccinations in 11 of our centers, but we could easily do almost 5 to 10 times of this in a day, in a normal working day. So as we extend the hours, the numbers will gradually go up. The only constraint would, in my view, be the supply of vaccine itself.
So another question really, Dr. Raghuvanshi, is now about availability of both vaccines and a choice to those getting vaccinated. Since they are paying, even though it's 250 rupees per dose, it's been capped. Do you think it's time that people got a choice whether they get Covishield or they get Covaxin?
So I mean, it appears logical that the choice is given. However, it is, in my view, these are not scientific decisions, but these decisions which patients choose are based on the perception. And if the clinically vaccine is proven to be as efficacious as 81%, which is comparable to any of the products everywhere in the world, then there is no reason why there should be a hesitancy. So I think we need to educate people that both the vaccines are equally effective, and it is important that the community is vaccinated at a faster scale and faster pace, and more people receive the vaccine so that the herd immunity is developed. If we do provide a choice, there will be further confusion. So and another problem is that you're supposed to give the same vaccine, both the doses. So if one center has offered both, then there is going to be a lot of logistic hurdle as well. So in my view, one center, one vaccine is a right kind of an approach. What we need to do is to educate people in terms of the scientific basis on which these vaccines have been approved, and not just simply go by perception and uninformed opinions.
Yeah, no, fair enough. But I mean, in the sense that even when it comes to medication, the lay person does not have the information or the ability to discern between one brand or the other. They depend on their doctor, or they depend on whatever suits them for whatever reason. So it goes to explain then, as a consumer of a vaccine, they should have a choice. What about, Dr. Raghuvanshi, the pricing at 250 rupees of a cap? For private hospitals who will get 100 rupees as a service charge for administering those vaccines, is it worth your while?
Yes, so see, this is not a business proposition. There is no doubt in our minds that 100 rupees does not cover the fixed costs which are incurred in order to create the entire infrastructure and do the service. But it does cover the direct costs. And I think at this point of time, this is a contribution from the private healthcare industry to the nation's requirements and needs. And I think that is sufficient incentive for us to do so.
Just your thoughts on this whole debate about allowing large companies to vaccinate. A number of large companies have now said that if given an opportunity, they would like to take up the costs and vaccinate their employees and their families as well. Do you think this should be allowed sooner than later, or when do you see this next step being rolled out?
I am very supportive of that idea. That's a great idea. One is large communities will get vaccinated in a short period of time. Hospitals, networks such as ourselves and others can support these companies to get that vaccination. And I think this is the kind of situation where, all available resources need to be channelized. And since the hospitals are willing to do their bit, and they're doing it for last few days and are going to continue to do so, I think it may be a good idea to allow the companies to spend their funds in order to vaccinate their staffs. And private as well as public sector can assist them in doing so. That way we can spread the vaccination to a much faster pace, because eventually the objective is to get a herd immunity. And that will be done only when a certain critical mass of people is already vaccinated. So the faster we do it, the better it is. And that safeguards our economy, and it safeguards the lives of these people.
Absolutely. Thank you so much, Dr. Ashutosh Raghuvanshi, for joining us on this chat. We've seen those pictures of big crowds at vaccine centers for the first couple of days. Perhaps no need to crowd these centers now, because private hospitals have been allowed to come on board and administer these vaccines at any given time, even beyond 9 to 5. And that should come as a sort of relief to unclog the system. So wait your turn, book it at the appropriate time, and do go and get vaccinated. Both your options now are equally safe as they were, but even perception wise.